Hi, this is Kelly, and you're watching Reading Between the Legs. This is honest talk on sex, health, and soul. So, today I'm actually just gonna. So, there was a little bit of news that came out today. Actually, it came out about a week ago from the CDC. I was planning on talking about STDs anyway this episode, so this was perfect timing. So basically, their 2018 report of STDs just came out, and it showed that STDs have increased now for the fifth consecutive year in a row, and the combined cases of gonorrhea, chlamydia, and syphilis are at an all-time high in 2018. So I guess this is perfect time for me to address this issue. So just a little bit of basic information. STDs, it stands for sexually transmitted diseases. About 5 years ago, they started using the term STI, which is sexually transmitted infection, although I'm still hearing a lot of STD being used. So STDs can be either bacterial or viral. They are passed through some sort of sexual contact. So that means vaginal sex, anal sex, oral sex, or honestly, I think I talked about this, the episode about HPV. It can literally, some of them can just be contact of skin on skin in the genital area. So STDs are the most commonly reported diseases in the United States. Not all are just spread through physical contact, but they can be spread by sharing needles. But that's really HIV, hepatitis, where we see that happening. So not all STDs have symptoms. They can be present for years without detection if you are not being tested. So, like I said, the CDC came out with this report from 2018. They are the agency in the United States. So CDC is the Center for Disease Control. They are the body in the United States that keeps track of certain diseases in the United States. They also can report on certain diseases in other countries, although I use it primarily because I work in the United States for information about what diseases, especially sexually transmitted, since that's what I deal with mostly, are in the United States. I try to keep up on numbers and so that I know what I need to look out for, basically. So gonorrhea, chlamydia, syphilis. Those are the three big ones that were just reported from the CDC this past week. So those are the three I'm going to talk about today. Now, there are other STDs. These are bacterial, so I'm going to talk about them today. I can address other ones in the future. I really would like to talk about HIV and herpes as well in the future. So those will be other episodes. So, like I said, bacterial STDs are spread through sexual contact. So, secretions like vaginal fluid, semen, also certain secretions in the anus, and saliva from the mouth. They also can be spread into around, like they are spread from those secretions and then passed to the other person, where I'm not going to get too technical, but where it can live and grow. So that's what it is. It's a bacteria. So just like me touching the desk, I can get bacteria on my hand and touch you, and I can spread that bacteria to you. So that's kind of how STDs are spread, and that's why they are so easily spread. Now, gonorrhea itself, so just to talk a little bit about numbers here, I hate to talk too much about them, but just to give you an idea of this, I call it a crisis, that's happening the last 5 years in our STD numbers. So gonorrhea increased 5% between 2017 and 2018. That doesn't seem like a lot, but this is the highest number of gonorrhea we have had in 1 year since 1991. That is a long time ago. That's, wow, crazy. So gonorrhea can be very dangerous during pregnancy. Signs and symptoms of gonorrhea can be pain, burning, abnormal discharge, either vaginal or penile discharge, irregular bleeding, and bleeding with intercourse. It can cause a blood infection. It can also be spread to joints and can cause heart problems if it goes on for too long. And like I said, it can be very dangerous in pregnancy. It can cause certain problems during pregnancy if it's not caught and treated. So it can be a serious disease. The other big thing about gonorrhea, which I find terrifying, is that we are now seeing some drug-resistant strains to gonorrhea. So that means the bacteria is smart. I mean, it's a living thing. So bacteria has figured out, the gonorrhea, that this certain drug will kill me. So I'm going to grow so that you can't get rid of me anymore, basically. So in states like California is the biggest one, but mostly overseas, we are seeing drug-resistant strains that are not being treated by the usual treatment. We usually use Rocephin and also azithromycin. So 2 antibiotics. One is given by mouth, so it's a pill. The other, we actually have to give an injection. That's the best way to treat it. There's a pill for it, but the best way is really by the injection. So that's gonorrhea. Scary, super scary to me because the drug resistance, honestly, it can be quite terrifying. So chlamydia increased 3% from 2017 to 2018. Not a huge jump. And I understand that sounds kind of silly that I'm freaking out about the 3%. What I am not happy about, what I'm kind of freaking out really about, is this is the most cases that have ever been reported in 1 year to the CDC. The most cases of chlamydia we have ever seen reported to the CDC in 1 year. That is scary to me. Now, what are the effects of chlamydia? Well, it can cause, to women, it can actually spread to the uterus, to the fallopian tubes, and cause serious damage, as well as a serious infection called pelvic inflammatory disease. So 10 to 15% of women that have chlamydia go untreated, end up with pelvic inflammatory disease, also known as PID. PID can result in things like abscesses, infertility, scarring of the tubes so that you're infertile. I guess that's kind of the same thing. Women can end up with ectopic pregnancies, which can be very dangerous if not caught. And also just end up having to lose. I've had girls that have lost both fallopian tubes because of pelvic inflammatory disease. So it's not a joke. It's like it could lead to serious problems if it's not caught and treated. Chlamydia also can be passed during childbirth and can cause a nasty eye infection for newborns if it's not treated before delivery. What else can I tell you about it? I guess those are the big things that scare me about it. Signs and symptoms are things like burning with urination, abnormal discharge. Those are really the biggest things, but I find that chlamydia, from my experience at least, does not really usually have symptoms. Women usually think that they're just getting a routine STD test and come back positive for chlamydia, and it's not something they are even having any kind of symptoms of. So that's another reason chlamydia is kind of a big deal. And like I said, it can cause problems during pregnancy as well. So really important, if you're pregnant, make sure you're getting tested. Most healthcare providers, it's like a policy in most places that women get tested late in pregnancy just to be sure. But if you're pregnant and you're trying to get there, just ask, make sure you're getting tested throughout. and I'll talk about the trusting people and all of that stuff in a bit, because I know people are like, well, I'm pregnant, nobody better be messing around. Well, I have different stories than that. So anyway, both of those two things easily treated with antibiotics as long as it's caught early and we're not seeing any like serious side effects from it. So syphilis, this one is actually very scary to me. The rates have increased 76% since 2013. So from 2013, 2018, 76% increase of syphilis. Also, from 2017 to 2018, it increased 14% in just that 1 year. Those are the highest rates we have seen since 1991. Now, syphilis is spread by contact with a sore or shedding of the bacteria through a sore that isn't always visible. So it's not like you are going to see something large on someone and know that they have syphilis. That's not always the case. The biggest thing with syphilis also is we see a lot of rates of syphilis with HIV and a sore from syphilis. So this is a sore in the genital area. The sore itself actually increases your risk of getting HIV because it's an open sore on your body. So it also can be spread to a baby during pregnancy, just like I was talking about the others. But syphilis being spread to a newborn during delivery, during pregnancy, or we find it after delivery, can cause death, newborn death after delivery, and also stillbirth. So huge, obviously, very scary, something you want to catch early if you're pregnant. So the congenital syphilis numbers increased 40% from 2017 to 2018. Now, I am blown away by these numbers, mostly because we test, at least in my clinic and in clinics I've worked in the past, we test women as early as 6 to 12 weeks for syphilis. And then we do a repeat test at 28 weeks, around there, to be sure that it's still negative. Because there's like a time where you're exposed and it doesn't show up in your blood until so many weeks, and I won't get into all of that, but we retest twice. So how have our rates increased 40%? That's either saying that we have doctors, nurse practitioners, midwives out there that are not doing their jobs by doing the proper testing, or there are so many women out there that have not been seen for an entire pregnancy, are positive for syphilis, and then are delivering a baby, and that's when we find out that they have syphilis and that the baby does. So super scary to me. Like I said, I don't understand how this is happening, and we're losing babies because of this. So newborn deaths or stillbirths, I mean, there was quite an increase between 2017 to 2018 in those numbers as well, just because of all these cases of syphilis have come up while women are pregnant. So, syphilis is also, doesn't always have symptoms, just like I was talking about gonorrhea and chlamydia. There's 3 different stages, actually. The first stage, people usually have symptoms. After that, they don't have symptoms until they are really sick. It can spread to organs in your body and cause serious damage. It can spread to the brain as well. It's called neurosyphilis. It can cause early Alzheimer's symptoms, seizures, things like that. I mean, it is no joke what serious problems can come from this if it's not treated. And it's so easy. It's just treated with penicillin. It's like an injection of penicillin. That's the treatment for it. Super easy. I mean, I don't like needles, but if it saved me from all that nonsense, please shoot me up. Oh, that didn't sound good, but I mean, give me the shot, please, basically. So how do we protect? Why is this happening? How do we protect ourselves from all of this? Number one thing, get tested. I encourage people to have open, honest relationships, trust your partner, but get tested anyway. I have had too many women that say, I don't need tested, but why not? Let's do it anyway. And they come back positive for gonorrhea and chlamydia. I mean, I've seen it. So, I want to trust people out there. I know you want to trust your partner or husband or wife or whatever, but I'm telling you, things happen and people pass things on to each other. So if your insurance will cover it, which it should, and if it doesn't, I want to know about it because I've been doing research on this recently. You should at least get tested for gonorrhea and chlamydia. And they are encouraging testing of things like HIV and syphilis every year now. That was a new recommendation that came out by the World Health Organization a couple years ago. And we're just now starting to get the ball rolling on that. But yearly screening for those things, because it's better that you know than you not know. That's basically what I think about it. It's just better that you know. So why is this happening? Well, people don't have insurance. They have poor access to healthcare, fewer treatment options because they don't have insurance. So they have few clinics that they can go to. Now, there's a lot of clinics that are called Title X clinics that get a specific type of funding. But unfortunately, and I'm not getting political, that funding has been decreased, and there's a lot of fighting going on right now about Title X clinics. I honestly had to stop listening for a while because it was like really breaking my heart that there are STD clinics that they were specifically there for testing and treatment of sexually transmitted infections, have lost their funding or have lost so much of their funding that they actually had to close. So of course, this is, part of our problem. We have people that have poor access to healthcare and they can't even go to a free clinic or a reduced cost clinic. So I worked in one of these Title X clinics, and what we did is, if you didn't have insurance, we put you on on kind of a sliding scale. So how much money do you make an hour, or what's your yearly, salary, whatever. So this is either you're going to have no cost at all, or you're expected to pay this based on your income. I felt like that was a fair way to do it, because then at least we're holding people accountable for paying a little bit of a bill, and they're getting tested. So they're not going to end up with things like pelvic inflammatory disease in the ER with a huge bill. We're just paying this much. We're taking care of the problem right now. Of course, I'm going to go back again to access to education and sexual health education. That's definitely one of the issues. I talk too much about it, so I won't go into it again, because you already know how I feel if you've been listening to me. But, I think the biggest thing is encouraging people to talk to their partners, get tested, use protection. Big things. Communication is key. Getting tested, you know your status. You know where you're at. You know if you have something to be concerned about. And also, use protection. Carry condoms. If you're a woman, carry some condoms. There are female condoms out there too. And actually, I've had some women that love them way more than male condoms. So female condoms, it's a thing. Look it up if you are interested. Also, like I was saying, communication is key, and that includes to your healthcare provider. So talk to them about it. I understand embarrassment, like fear, shame, like the social stigma of STDs and sex and all of that. But you should be able to talk to your health provider about these things. And you know what? If your healthcare provider is judgmental to you, then you just find a new one. Because at no point should you walk in a clinic, ask for sexually transmitted infection testing, which is a very responsible thing, by the way, and be judged or feel judged. That shouldn't be happening. So if it is happening, find a new place to go. because I honestly, and I would take care of everybody if I could, because I get it. I totally understand. It's part of life, and people get infections, and people make stupid decisions and have unprotected sex, or don't use condoms with oral sex, which honestly, a lot of people don't. But you can still get infections that way. So you just gotta like grin and you just gotta do it. That's just all there is to it. So, I have a lot of patients that deal with this as well, like with being shameful, feeling like they're being judged, apologizing to me because they're asking for something. Don't feel that way. It is your right, it is your health, and you should be empowered to take care of yourself and your health. I said, if your healthcare provider is judgmental, get a new one. I'm going to say the same thing about your sexual partner. If you have a sexual partner that you don't feel comfortable not using protection with, and you say, I want to use a condom, and they won't, you find a new partner. The same with, if they won't get tested, you're tested, you're all good, and you are asking them to get tested, and they won't, you need to find a new one, because you can't trust them if they are going to act like that. That's absurd. When I hear people tell me they won't get tested, I kind of want to scream. It's just not, it's not worth this like lifelong possible consequence that you could have, like never being able to have children because you got a pelvic infection when you were 20 because you didn't feel comfortable having that conversation. So have that conversation with your partner, have that conversation with your friends, have that conversation with your healthcare provider, your teachers, whoever you feel comfortable with, but you have to do it. You just have to. And you know what? It is up to you to protect yourself. I probably say this every single day to at least one patient. You are the only one that can protect you. I can help you. Your nurse practitioner, doctor, midwife, whoever can help protect you, but you're the one that has the final decision. So you have to be open, you have to be honest, you have to be transparent, and you have to be in charge of your healthcare. So there we go. That's what I got today. Y'all, if you've been listening, you know how kind of crazy I can get about this stuff, but it's for a reason. I unfortunately see too many bad things happening. And here we are, numbers of STDs being an all-time high. I mean, we are too smart for this. We just are. So there's clearly a breakdown somewhere. Now, I don't have all the answers, but I know that it can start with you. It can start with me, helping each other, educating each other. That's what I would just encourage you to do. So anyway, I hope you learned something today. If you have any questions, please let me know. I'll be posting on Facebook and Instagram, and just reach out to me if you have questions. I also have my new email, which is kelly@readbetweenlegs.com. So please just shoot me an email if you have anything for me. I'd love to get some feedback. I really hope you guys have a good day. I'll see you later. Bye.